HIV, short for human immunodeficiency virus. What is HIV? HIV is an RNA retrovirus. It means that it's a virus that uses RNA as its genetic material. So what goes on? It infects specific white blood cells with the CD4 receptor on their surface, as you can see here. CD4 is hijacked by HIV, which uses it to gain access to the cell. So what it needs is the CD4 receptor. So this is the HIV, this one here. It needs the CD4 and a co-receptor here to get access to the cell. Once it gets access to the cell, the virus's genetic material, RNA, is converted into DNA in a process called reverse transcription. All right? So the viral DNA is then inserted into the host cell's DNA, where it remains for the lifetime of the cell. If the immune system is triggered, so this immune cell will produce viral proteins and RNA, which contain the HIV DNA. And that's how it infects the whole body. So as it leaves the cell, it is disruptive, that it disrupts the cell membrane of the cell, and this leads to host cell death. Now, HIV is transmitted in semen, blood, vaginal fluids, transplanted organs, and breast milk through breastfeeding. So it can be transmitted through semen and vaginal fluids, through unprotected sexual intercourse, through blood, if infected blood is entering the body, such as in a transfusion, or IV drug users sharing needles or syringes, or needle stick injury. Another thing is artificial insemination and organ transplantation. Artificial insemination, which goes back to the semen being a transmitter. Another thing is breast milk, infected mothers to babies during pregnancy, at birth, or in breast milk. As for the investigations, when we suspect HIV, the first tests we order are HIV antibodies. We also need to order full blood examination, differential white cell count, and CD4, which are all very important. Viral load test, which is an indicator of HIV level in serum. G6PD should also be ordered, which because the drugs can be oxidative, so as not to exacerbate an existing G6PD deficiency. Another important thing is serology for torch infections, for syphilis, for hepatitis A, B, and C. We can also test for other sexually transmitted infections such as gonorrhea, chlamydia, herpes, and we can also check for thrush. And finally, we can also order MAN2 test for tuberculosis. So let's talk about the clinical presentation of HIV. So it usually starts with an acute infection in 70% of patients. So the acute infection presents with fever, rash, lymphadenopathy, pharyngitis, and myalgia and diarrhea. And this usually happens 2 weeks after exposure. And then we go to the asymptomatic infection phase, which lasts for several years following infection. And then the immune deficiency starts to show up by multiple symptoms related to declining CD4 T cell counts, such as oral thrush, diarrhea, weight loss, skin infections, and herpes zoster. And the complication of HIV infection and the complication that we're trying to delay as much as possible or prevent with treatment is AIDS. So what is AIDS? AIDS is short for acquired immunodeficiency syndrome. So when do we think that this person has progressed to AIDS? So there are two markers that we can use. The first one is the CD4 count. If the CD4 becomes less than 200 cells per cubic millimeter of blood, so that's the first marker, or they develop one or more opportunistic infections, regardless of their CD4 count. So it's either the CD4 becomes less than 200 or the opportunistic infections start to appear. The opportunistic infections can be pneumocystis cerevisiae pneumonia, esophageal candidiasis, cerebral toxoplasmosis, and cancers such as Kaposi's sarcoma, which can appear as red or pink raised lesions on the skin. Another thing that we do to diagnose HIV, after we do the antigen antibody test and it turns out to be positive, then we can do a Western blot just to confirm the results. Another thing which is very important, there's something called a window period. So even if a HIV is negative when we first test and the person is high risk, we should test again or retest after 12 weeks, which can be a window period where the HIV antibodies are still not present. Regarding the management of HIV, so what we do is we can give antiretroviral treatment. And current evidence actually suggests that all people living with HIV should start antiretroviral treatment as soon as possible after diagnosis, where before it was said that it's according to the CD4 count and the clinical picture of the patient. Now we suggest that it starts as soon as possible after the diagnosis. Now the guidelines of how to use antiretroviral treatment are always changing. Currently, the use of 3 antiretroviral drugs for ART is preferred. Monotherapy is not accepted at all. Other aspects that are important in management are we should always discuss complex issues around HIV transmission. And we need to inform sexual contacts of HIV status and contact tracing. Do contact tracing. We can ask the patient to do so or offer support. So how do we do contact tracing? We can start with recent sexual or needle sharing partners. Outer limit is onset of risk behavior or last known negative HIV test result if known. There are also post-exposure prophylaxis and pre-exposure prophylaxis available, where you can seek them in specialized clinics. Another important aspect of the management is psychological support. So we can consider psychosocial support, and we should avoid overemphasis of technical discussions about treatment options in the initial discussion. We can also emphasize or make sure the patient is aware that HIV is not AIDS, and HIV now is a condition that a patient can live a happy long life with, and the treatment is very effective. So we can refer the patient to a psychologist if needed, We should also provide the patient with a fact sheet and notify the state or territory health department, as HIV is a notifiable condition. Another important aspect of management is follow-up. Follow-up is recommended after diagnosis within a few days to check on psychosocial well-being and to review baseline investigations. So that's it for this video. I was trying to be brief, try to mention as much as possible about the HIV and AIDS. If you need any topic to be more in depth, please leave a comment below. Thank you very much for watching. Please like this video, share it with your friends, and subscribe to my channel.